Have you ever felt overwhelmed trying to figure out exactly when you can sign up for Medicare, switch your plan, or even drop one? You're not alone. Navigating Medicare enrollment windows can feel like a maze, especially with all the rules, deadlines, and penalties that can sneak up if you miss the right dates. But the truth is, understanding these enrollment periods can save you thousands of dollars and protect you from unexpected gaps in coverage. Today, I'm going to break down everything you need to know about Medicare enrollment windows in a way that's simple, straightforward, and actionable. By the end of this video, you'll know exactly when and how to act, so you never miss a critical window again. Let's start with the most important one, the initial enrollment period. This is your first chance to sign up for Medicare, and timing is everything here. Your initial enrollment period is a 7-month window. It begins 3 months before the month you turn 65, includes the month of your birthday, and extends 3 months after. For example, if your birthday is in June, your initial enrollment period starts in March and runs through September. During this window, you can enroll in Medicare Part A, which covers hospital care, and Part B, which covers doctor visits and outpatient care. If you miss this window, you could face late enrollment penalties that increase your monthly premium for as long as you have Medicare. Some people may still be working past 65 and have health coverage through their employer. In that case, you might qualify for a special enrollment period. Special enrollment periods allow you to delay Part B without paying a late penalty, as long as you enroll within 8 months of losing your employer coverage. This is critical for those who want to keep their existing insurance while transitioning to Medicare without being penalized. Now, let's talk about the annual election period. This is one of the most active times for Medicare beneficiaries because it allows you to make changes to your coverage. The annual election period runs from October 15th to December 7th every year. During this period, you can switch from original Medicare to a Medicare Advantage plan, change from one Medicare Advantage plan to another, or switch your Part D prescription drug plan. The changes you make during this period take effect on January 1st of the following year. Missing this window could mean waiting another full year before you can make adjustments, so it's crucial to pay attention to this time frame. There's also the Medicare Advantage open enrollment period, which runs from January 1st to March 31st. This is a smaller window specifically for those already enrolled in a Medicare Advantage plan. During these 3 months, you can switch to a different Medicare Advantage plan or revert back to original Medicare. However, it's important to note that during this period, you cannot make changes to your Part D prescription drug plan unless you're switching back to original Medicare, so planning ahead is key. You should also know about special enrollment periods that are triggered by life events. These events can include moving to a new area, losing other insurance coverage, qualifying for Medicaid, or experiencing certain health changes. Special enrollment periods don't follow the standard calendar and can happen at almost any time, depending on your situation. Understanding these events and how they trigger an enrollment opportunity can prevent gaps in coverage and unexpected medical bills. Many people underestimate how these enrollment windows interact. For example, if you enroll late in Part B, not only do you face a penalty, but your options for Medicare Advantage and Part D enrollment may also be delayed. That's why timing and strategy matter. Knowing when to enroll, switch, or drop a plan isn't just about avoiding penalties. It's about ensuring you have the coverage that meets your needs and your budget. Now, here's a pro tip that many seniors overlook. Even if you feel your current plan is working fine, it's important to review your coverage every year. Prescription drug formularies change, benefits may shift, and premiums can rise. The annual election period is your chance to shop for a plan that fits your needs better or saves you money. Don't assume that your plan from last year is automatically the best choice this year. Let's take a moment to talk about timing strategy. If you're approaching your initial enrollment period, it's wise to gather all your information before the window opens. Know your current coverage, your health needs, and your prescription drugs. Compare your options carefully and make a decision before the 3-month lead into your birthday. Procrastination here can cost you hundreds or even thousands of dollars. If you're already on Medicare and thinking about making a change during the annual election period, make a list of what matters most. Are you looking for lower premiums, better coverage for your prescriptions, or access to specific doctors? Prioritize these factors before browsing plans so that when the enrollment window opens, you can act quickly and confidently. I want to stress one more time the importance of acting within these windows. Missing the initial enrollment period can lead to a permanent Part B penalty. Missing the annual election period could lock you into a plan that doesn't meet your needs, and ignoring special enrollment periods could result in gaps in coverage. Knowledge and preparation are your best tools to navigate Medicare successfully. Before we continue, here's something you should do right now. Take out your calendar and mark the key Medicare enrollment windows. Knowing the dates visually can prevent last-minute stress and penalties. For seniors over 65, this simple step alone can save you from costly mistakes. And if you're unsure which enrollment window applies to your situation, take a moment to review your personal health coverage and employment status. Now, I know this might sound overwhelming, but here's the good news. You don't have to figure it all out alone. At Medicare Mentor, we focus on helping seniors understand their options and make confident decisions that save money and maximize benefits. You can review your options with a clear strategy rather than guessing and hoping you won't make a costly mistake. Remember, the right plan at the right time can mean lower out-of-pocket costs and peace of mind knowing you're covered. Finally, let's talk about what happens after you enroll or switch a plan. Always confirm your enrollment, keep track of your plan documents, and monitor any notices from Medicare. Some plans may require additional steps or documentation to finalize your enrollment. Staying proactive ensures you don't experience delays in coverage or unexpected bills. So, to recap, there are 3 main enrollment windows you need to know: the initial enrollment period, the annual election period, and the Medicare Advantage open enrollment period. Special enrollment periods may pop up based on life events. Your key takeaways are to know the dates, plan ahead, review your options annually, and act within the designated windows. Doing so gives you control over your healthcare, saves money, and keeps you covered without surprises. Medicare can seem complicated at first, but with the right knowledge and preparation, it's entirely manageable. The best part is, once you understand these windows and how to use them strategically, you gain freedom and security over your healthcare decisions. Don't wait until the last minute. Get organized, review your options, and make the best choices for your health and your wallet. Remember, Medicare is a tool to help you live a healthier, more secure life. Understanding the enrollment windows is your first step in mastering it. So take action now. Mark your calendars, review your coverage, and make decisions that protect your health and your finances. And if you ever feel unsure, reach out to Medicare Mentor. We're here to guide you through the process, answer your questions, and make sure you get the coverage that's right for you. The bottom line is simple. Knowledge is power when it comes to Medicare. Knowing when to sign up, switch, or drop a plan can make the difference between smooth coverage and costly mistakes. So take the time to understand your enrollment windows, plan ahead, and make informed choices. Your future self will thank you.